Ladies and gentlemen, Dr. Rasu Shrestha.
Good afternoon, everyone. How are you doing? Awesome. So there's a famous quote from a hockey player that you might have heard of who says, you miss 100% of the shots you don't take. Wouldn't you all agree that with all of the interactions that we've had in the last 2 days, the chances of hitting that puck into the place that you want to score has increased dramatically? A round of applause to this conference. So I'm here to talk about the imperative for innovation in a space that's, I think, familiar to all of you, to all of us, whether you work in healthcare or you don't. We've all engaged in healthcare. We've all had our run-ins with healthcare. And the need for innovation in healthcare is more today than ever before. So I wanted to talk a little bit about that. When we talk about hitting 100% of the shots, it's also really important to understand that there's a lot of hype. And in a space like healthcare, there's also a lot of hope. But how do you move from hype to hope and make it real? Go from hype to hope to here. Right? So we'll talk a little bit about that, and in doing so, I'll talk a little bit about some of the things that we're doing at UPMC to make that happen. So we'll start with this. So all of the people here on this slide, in fact, all of you around the room, and me, and everyone, we have one thing in common. So the one thing in common is that we've all engaged in healthcare, right? The other thing in common, too, is every one of these individuals on this slide, and in fact, all of you, we have health records that are dispersed in silos of information systems that probably aren't talking to each other today. They're locked away, they're captured, they're captive, right? And we all go see a doctor, we all engage in healthcare, and we all have this hope. We all have this trust when we speak to a physician, when we go to a hospital. And all of these patients, all of these people trust in us to provide to them the very best care that we absolutely can. So the question that I always ask myself is, are we doing enough to essentially provide to all of these people, all of us, the very best care that we absolutely can? Are we doing enough? We shouldn't take that trust lightly. This is the Gartner hype cycle, and you might have seen multiple iterations of this. This is the more recent emerging technologies Gartner hype cycle, and there are many things on this hype cycle. Right at the top is the Internet of Things. Right? You've got a number of other things. Consumer 3D printing, there were some nice presentations yesterday in terms of the innovations that are coming into the space. Rob, in his keynote this morning, talked about augmented reality, so that's coming further down from the peak of inflated expectations to the trough of disillusionment. So it's becoming more real than ever before. So there's a lot of hype. Right, so when you go to conferences, IT conferences, when you go to websites and you look at marketing materials, and there's a lot of hype out there, and especially in healthcare, it's really important for us to understand that hype is okay, but at the same time, how do we make all of this real? How do we make a difference in the life of that patient that's sitting on the other side of that company, of that innovation, of that investment that we're making as a group across the board? One of the other things that we see in healthcare is that we have a tradition of complexity. It's a complex environment. For any of you who've engaged in healthcare, that's all of us, we understand how complex healthcare is, right? So this was a tweet chat that I participated in just a couple of weeks ago. And one of the things that I mentioned here is in healthcare, we tend to wrap ourselves in this warm blanket of complexity. This blanket you just don't want to let go. Anytime someone wants to yank it away with some innovation or some really out-of-this-world company or technology, we pull it back up and say no. Because maybe we confuse it for better. We think more complex is better, but I would argue that is absolutely not the case. In fact, one of the single biggest imperatives in healthcare today, I believe, is to simplify. Innovation isn't just about adding more things into that application or into a program or into that approach until you can't add any more, because we have that right now. It's about taking away as much as you absolutely can and making sure that that system, that technology is humming, right? So that we can make technology invisible. As a physician, I'm telling you, look, in the last decade and a half, we've done a lot of things in healthcare to move from analog to digital. But today, we're inundated with technology, which is not a bad thing onto itself, except I want more time with my patients. I want less time clicking through screens and trying to put information together. And so this mandate for simplicity, I think, is really, really important. I thought I'll point this out. So with all of the electronic medical record systems that we have and all of the electronic paraphernalia that we're surrounded with, emergency department physicians spend 44% of their times entering data into their EMRs, clicking up to 4,000 times during a 10-hour shift. That's a lot of clicks. 44% of their time entering data into the EMR. The EMR, for those of you who've engaged in healthcare or have companies or investments in this space, really was created initially as a glorified electronic documentation system and a billing system. So I have nothing against EMRs. I've used many of them, right? The argument that I'm trying to make here is how do we simplify? How do we change the focus from not just let's document better so that we can bill and we can get paid for the services that we provide, but how do we really focus in not letting those patients down who are trusting us to provide the very best care that we can. So healthcare is complex. As we gaze into the crystal ball of healthcare and look into the future, what do we see? Right? We see that the costs are continuing to increase. Healthcare today is it's a remarkable industry. If you guys aren't in it, you should be. All right, it's like a $3.5 trillion industry. It's absolutely remarkable. The opportunities are tremendous, but the costs continue to escalate. Right? Reimbursement, which is what we get paid for, continues to decline. For the same studies that we're performing today, we were getting paid a lot more 5-10 years ago. Same darn studies, right? We're getting paid less today. So the reimbursements are declining, the costs continue to increase, the complexity continues to increase, quality is still very, very questionable. There was an Institute of Medicine, an IOM report that came out some years back that basically said that today, because of medical errors that happen in hospitals, there's an equivalent of one jumbo jet worth of patients dying every day. So the quality isn't good enough either, right? So there are lots and lots of opportunities. There are two big trends. I wanted to sort of drive it home to you in terms of the imperative for innovation in healthcare. Two big trends that I wanted to point out. One is healthcare reform, right? Call it Obamacare, call it whatever you may. Healthcare reform, the train has left the station, right? So there's lots of things that you've seen in the media out there, even in the last couple of years with what's called the Meaningful Use Program. It's been $30 billion in money that's been doled out to physicians and hospital systems to basically implement electronic medical record systems. And that's been great. That's wonderful because we've moved in large parts from paper-based charts now to electronic medical records, and the jump from close to single digits to today about 70%, 80% of organizations across the United States being on electronic medical records, that's tremendous. So healthcare reform is fantastic. There's also this big trend of consolidation. 87% are considering some level of alignment or consolidation. And this is not just for hospitals or physician practices. This is true for payer organizations and health plans, but also for companies, right? The investments that you guys are making, the companies that we're seeing out there, little companies being bought out by larger companies. So whether it's IBM buying Truven Health Analytics for $2.6 billion, or whether it's other companies that are merging together, there's a lot of consolidation that's going on. So what does those two things actually equate to, right? So you've got consolidation and you have healthcare reform. We think they equate to opportunities. Because with consolidation, there are challenges of interoperability, right? You've got these silos of information systems that now need to really talk to each other because they're consolidated. But how do we make the data flow, and how do we make sure that we're able to interoperate between these consolidated systems or hospitals or clinics? With healthcare reform, there's this big movement called volume to value. Right? Traditionally, in the last decade, 2 decades, in fact, for the last couple of centuries, healthcare has really been about volume. Right? We want to fill up our hospital beds. We want that ED to be as busy as possible. All of those $1 million scanners that we bought, the CT scanners, the MRI scanners, we want them, are churning out patients hourly and making sure that we're getting the biggest bang for our buck in terms of our return of investment, right? It was very much a volume-driven approach to business in healthcare. Today, the conversations are more about value. It's value-based healthcare. It's not just about let's get as many patients through the door as possible, but it's really about value. And value speaks to quality. Are we providing the quality of care that we need to? And what's interesting is we're being paid, increasingly so, for the value of the care that we're providing, not just for the volume. So that's an interesting movement that we're seeing in the healthcare industry. So how do we move from this application-centric environment to more of a patient-centric environment? How do we make sure that these newer care models around value-based imaging are algorithmized and put into the very innovations of the technologies that we're actually inventing today? So data is everywhere. As a physician, I'll tell you, we're today data-rich and information-poor. Today, I'm more of a detective than I am a physician, because I'm always piecing information together from all of these systems and trying to get at just enough information so that I can write a prescription for the patient, or I can decide on what's wrong with him or her, or decide on the next protocol that I want to try to follow in my clinical care pathway. So the imperative for us to get to data liquidity, which is a big strategy for us at UPMC, is one that we don't shun. This is something that we've been working on for years now, and we're really pushing the boundaries of leveraging the zeros and ones that we have in our silos, right? At UPMC today, we have 5.9 petabytes worth of data that continues to double every 18 months. So it's amazing the power, the potential that's behind this data, the insights that we can garner out of the data as a payer and a provider organization, the yin and yang. That really is what healthcare is about, not just in Pittsburgh, but really across the United States, because we're moving towards this value-based healthcare paradigm, and that's being driven by payer-provider dynamics, which is what we're all about at UPMC. So data liquidity is really critical. So just to recap, we moved from all of that, these are paper charts and film and analog, very quickly to digital, right? So now we've got all these pop-ups and screens and computers that are okay, they're fine, but that's not good enough. So phase 1 was analog and film and paper. Phase 2 was EMRs and filmless and digital. And phase 3 is what we need to strive for, right? So phase 3 is about data liquidity, achieving better interoperability and getting at insights through analytics and technologies and capabilities such as machine learning and big data, and looking at populations of patients, not just at that patient that's in front of us, but similar patients. Looking at population health, looking at chronic disease management, and a number of other things that I'll get to in just a couple of minutes. So the imperative for us to move from phase 1 to phase 3 is really remarkable in healthcare today. So I talked quite a bit about, or a little bit about value-based healthcare, but this is really a depiction of value-based healthcare in the back of a napkin, because I like to try to simplify things for all of us. So today, we're really at the bottom of that pyramid. We're, as I mentioned, data-rich and information-poor, right? So we've got all these silos of information systems that we're trying to aggregate data from, and we're trying to organize and harmonize the information. So the challenge is, how do you move from data to information, from information to knowledge, Marry that with evidence-based guidelines, clinical best practices and protocols. Heck, the symptoms of the patients that are in front of you, right? Maybe look away from the EMR for a little bit, stop entering data into the EMR and talk to the patient, empathize with the patient, right? Marry that with all of the specific data elements that the patient presents, and perhaps we can get to the pinnacle, which is wisdom. Because the further up that you go up in this pyramid, the further up that you go in the value chain as well, right? And what's interesting is we're starting to see initiatives across the industry where healthcare organizations and physicians and payer-provider organizations and what's called accountable care organizations are actually being incentivized towards value-based healthcare, right? So we're being paid to improve quality. We're being paid to collaborate and talk to each other across the care team. Imagine that, right? So that's a great push forward because we're moving towards more of a patient-centric environment as opposed to an application-centric environment. So that's your doctor's office, and what you see there is this data liquidity notion coming to life. Right, so there's this concept called the patient-centered medical home, and this is something that at the health plan we've been pushing for quite a bit at UPMC. The notion here is how do we make sure that with the patient in the middle, we've got all of his care team, the GI specialist, the radiologist, the primary care practitioner, collaborating with each other and making sure that the center of attention is really the patient. How do we make sure that this care coordination happens in an optimized way, that we're leveraging technology for things like virtual care collaboration, that we're really looking at real-time bidirectional communication and engaging in the care of that patient and coming up with the right types of protocols to address the specifics of what the patient needs, avoiding duplicate therapy, making sure that we're able to effectively manage the care process for this patient, eliminating unnecessary utilization, meaning that if the patient doesn't need a certain type of a scan, let's not just do the scan because that's what we've always done. Right? The patient doesn't need to be zapped with more radiation, having come into the hospital with a suspect tumor in his lung. Right? We don't want to give the patient a tumor because of the radiation that we're zapping him with. Okay? So this is really important, and these are the types of things that we're really trying to drive for at UPMC. But then there's more types of data. Right? So this is a Time magazine cover article that says never offline. Right? And Rob talked eloquently about this in his keynote this morning. Right? The fact that there's just so much data coming at us. Right? Wearables, the Internet of Things, this big data bang, right? There's just so much data that's going to be coming at us even in the next couple of years. This is social media, okay? So that actually shows, that's my Twitter handle there, at Rasu Shrestha, and that shows my network. So there are multiple analytics that can be run on social media. And this shows my network visualizations at the top. You probably can't read it, but marked in different colors are industry and patients and advocacy and media outlets and journalists and their doctors and hospitals. So that's good. There's a lot of blue. I'm interacting quite a bit with my colleagues across the board. So analytics on social media and big data can really get to insights that might really make a difference. One of the big things that I've seen grow in the last couple of years has been an online conversation on patient populations, right? There's hashtag BCSM, breast cancer social media. There's a lot of conversations going on online today, as we speak, about breast cancer. And this is just one specific disease or one specific patient subset that is really clustered together because there is this need for us to share. There's this need for us to empathize. There's this need for us to get more information and learn from each other. And social media is a vehicle that allows for us to do this. So there are doctors, there are patients, there are advocacy groups, there's the industry and this media that's really clustering towards social media. So how do we leverage that data to get us better insights? You're able to cluster them into therapeutic areas and hospitals and advocacy groups. So there are lots of things that you can actually do with big data analytics on social media. So it's not just about the 20 minutes that you spend in your PCP's office in that annual physical that you may or may not undergo every year. It's really about the 525,580 other minutes in that year. Healthcare shouldn't just be episodic, right? It's that one episode when I run into healthcare, right? Or I fall down, or I get into an accident, or something bad happens. It shouldn't just be about that one single episode. This was from an ad in the New York Times by Manhattan's Mount Sinai Hospital in 2015. And I completely agree with this statement. This is the future of healthcare, right? And we feel the same way here. If our beds are filled, it means that we've failed. We don't want patients in our hospital beds. And this is shocking news to a lot of people, but it is true. And it doesn't just make for a nice ad on a popular publication. This is true because patients don't actually do great when they're in the hospital. Okay. The other thing too is, from a payer-provider perspective, when you look at cost and quality and access, right? Costs are better controlled overall for the system if the patient doesn't end up in the hospital. Right, so there are lots of things that are really driving towards some of the areas of innovation that we need to be focusing in on. The one thing I always say is healthcare shouldn't just be about curing disease. It shouldn't just be about avoiding death. That's what we've been focusing in on for the last couple of centuries, really, right? Cure polio, let's not get killed before we turn 40. Right? Immunizations, okay, that's wonderful. I'm not saying let's leave the diseased on the wayside and we all wear Fitbits. That's not what I'm saying. What I'm saying is healthcare shouldn't just be about curing disease and not dying. It should be about living. It really should. So that brings us to innovation in the space of healthcare, because innovation, I think, is really about behavior change. It's not about better UIs and color palettes and sexy applications that hum, about nice watches that you may wear and apps that you may download. It really is about behavior change. So whether it's for that physician that's so stuck in the past in the way that he's thinking around volume-based healthcare, whether it's about that patient who's thinking or not thinking twice about grabbing that second slice or the 10th slice of the pizza, right? And contemplating whether or not I should go on a walk or recovering from knee surgery. Innovation is about behavior change. Technology, as I mentioned earlier, really should be invisible. So how do we do this? How do we go from all of the hype and the hope and go to here, right? How do we birth this? How do we make this real? Because that's really important. So one of the things that we've been doing at UPMC is we've been trying to focus on this. We've been trying to say, all right, how do we make this happen? So at UPMC, we've had a good track record of success in the last decade or more around companies that we've taken or we've built, right? And commercial successes that we've had. So a lot of these companies or these successes are seen as lightning strikes. So we've had people come to us and say, hey, those were lightning strikes, right? So with Stentor, which is one of the leading PACS companies today, come out of UPMC. DB Motion, an interoperability company, had a lot to do with UPMC. We've had lots of successes in the past. So what we said was, all right, they were lightning strikes perhaps, right? But how do we create a lightning factory? How do we make sure that this discipline of leveraging UPMC as a living lab, the insights that we can garner from the 5.9 petabytes worth of data that continues to double every 18 months, the payer-provider organization, the 3,800 physicians, how do we make sure that we're able to really tap into all of that and create an environment that makes innovation in the healthcare realm and commercialization of the technologies in that space, give it a better chance of success? How do we actually do that? So at Bakery Square, which is close to CMU and not too far away from Pitt and from some of our hospitals like Shadyside and the Hillman Cancer Institute, we're headquartered there. So UPMC Enterprises, just downstairs from Google, and Pitt is actually upstairs as well. So UPMC Enterprises really is a culmination of all of the great things that UPMC has been doing in the space of innovation and commercialization in the last decade and a half. So about 2 years ago, we started pulling all of the good things that have worked, started learning from the lessons of things that have not worked as well, and we put together what we're now calling UPMC Enterprises. And UPMC Enterprises really is the tip of the spear in terms of our approach to commercialization and innovation to address all of the different challenges and the pain points that I referenced earlier. Tal Heppenstall, who's the president of UPMC Enterprises and also the treasurer of UPMC, he'd tell you, look, we're all of the above and none of the above. We put our money where our mouth is. We like to invest in technologies and companies of various ranges and various sizes, including companies or technologies and solutions that are just coming out of really strong research work and have good commercializable opportunities to companies where they're perhaps a little bit further along and we may be leading a Series A or being part of a funding to provide seed capital for a certain company. So we're doing all of that. One of the other things that we're doing too is we're focusing in on specific areas of these challenges that we have in healthcare. So we've defined domains, as we call them, 4 specific domains at UPMC Enterprises. So the first is clinical tools. So this is leveraging data to drive towards better decisions at the point of care. Because it's really important. Like I said, we're data rich and information poor. So focusing in on things like precision medicine, ensuring that we're able to get better data for oncologists and radiologists, imagers, pathologists. This is critical. The second domain is population health. So this is a big buzzword. There's a lot of hype in this specific buzzword here. But our focus is really around managing risk. How do we better manage risk in this payer-provider reality that the world's functioning in today? The third domain is business services and infrastructure. So in the delivery of healthcare, lots of sort of back office things like revenue cycle management and supply chain management. How do we squeeze the waste out of healthcare? Because there is so much waste in healthcare, as many of you know. And then last but not least is consumer. How do we focus in on the consumer? This huge consumer engagement. People go and see Dr. Google before they come and see Dr. Shrestha, right? They're online and connected and engaged like never before. How do we make sure that this big consumerization of healthcare becomes more than just about consumer engagement? It becomes about consumer empowerment. We've sponsored what's called the Pittsburgh Health Data Alliance. So with Pitt and CMU, we're saying, all right, let's put that data to work for us. Focusing specifically around big data and machine learning. We're actually funding specific initiatives from the institutions. We're providing expertise in terms of not just data, but our clinicians and our living lab, right, across UPMC for the purposes of creating solutions that we would then be able to together commercialize from the Pittsburgh Health Data Alliance. These domains that I described aren't silos, right? So you've I think, gotten it in the last 10, 20 minutes that I'm less about silos, I'm more about building bridges. So how do we make sure that we're able to have more of a cohesiveness to all of the different domains, because there's a lot of overlap between the domains? How do we make sure that we're able to leverage principles of human-centered design, right? If you look at EMRs today, oh my goodness, they essentially were built to replicate analog. They essentially were built purposefully, and that's why we still call them charts, and we still have folders, and we still have files. In radiology, I'm a radiologist by background. We still call it hanging protocols. We don't hang film anymore. We don't even have film anymore. We still call it a wet read. The film, which doesn't exist, isn't wet anymore because it's on a monitor, right? Or 10, right? So this culture of embracing the old, the complex, and not letting go of it is so akin to healthcare, and we need to change it. So human-centered design thinking principles, these are things that we're really embracing and pushing forward in that lightning factory that I described earlier. Here's a select list of companies that we've invested in our current portfolio. I think I won't go through all of this, but Evolent Health is a company that 100% of their technology came out of UPMC's health plan. We started this company with the advisory board and TPG about 5 years ago, and last year the company went public, and when it went public it was valued at $1.2 billion. Right? Health Catalyst. Lantern is an interesting one. We announced this not too long ago, just a couple of weeks ago. This is a company out of San Francisco. Great team, right? Some of the discussions earlier about investing in that trajectory. That's exactly what we did with Lantern. They're in the space of mental health. Again, Pittsburgh has so much to offer when it comes to mental health. And I think there is just so much room for innovation in the space of mental health, taking the stigma out of mental health, making mental health resources through CBT protocols, which is what this effort is about, making it more readily accessible through mobile apps and mobile solutions to our consumers and patients. Vivify Health, MedCPU. So Lantern was, we actually led a $17 million Series A for Lantern. Let's see, MedCPU was another recent announcement. That was we were part of led the $35 million round for MedCPU, and we'll actually be hiring about 20 full-time employees and engineers here in Pittsburgh, so they'll have a significant presence here in Pittsburgh. So we're doing lots of things across the board, and this is just a selection from our portfolio. So how do we make it real, right? How do we go from hype to hope to here? So we offer up UPMC to our partners. We make sure that we're able to take advantage of the integrated delivery network that we're about, because that's where healthcare is going. Stephen Brill wrote a book. If any of you have read it, that's great. Kudos to you. If you haven't read it, it's 528 pages. Right? Stephen Brill, for just a tidbit there, is also the gentleman who wrote the longest ever Time magazine article. This is like a 40-page article, and it was titled America's Bitter Pill, right? The Sorry State of Healthcare, right? So clearly he had more to say, so he wrote a book that was released last year. And he talks about the sorry state of healthcare. And he's interviewed a whole bunch of CEOs and healthcare organizations. And we didn't pay him to write this book because, this is Stephen Brill writing about the sorry state of healthcare. But somewhere in the middle of the book, he says, if you're looking for a model for the future of healthcare, look no further than UPMC. And he actually calls us out. And what he specifically talks about is the integrated delivery network, how the payer and the provider organization actually work together. Because the provider organization, i.e. the hospitals, traditionally are incentivized to do more, right? Let's do more studies and let's fill up those beds. The payer organization, they're incentivized to do less. And we're saying, all right, what's in the best interest of not this part of the yin and yang or this part of the yin and yang, but of that patient that's in front of us. And I'm not just saying this, we're actually algorithmizing this, and a lot of the companies that we're investing in, that's what we're pushing for. So this is huge. So we're a strategic investor. We put our money where our mouth is. We're the living lab. We provide, we open up the rest of UPMC. And in our diligence process, as we look at partnerships that we want to form, we spend a lot of time up front working with our subject matter experts and finding the right clinical champions. So it might take a little while for us to kick things off, but at the end of the day, it's in the better interests of the initiative across the board, because we're able to have those champions. We eat our own dog food. We drink our own champagne. We don't just invest in these solutions and hope they succeed, right? So that's really important. UPMC is an academic medical center as part of the University of Pittsburgh, and I think that's really, really important. This partnership that exists between UPMC and UPitt is really important, and then the CMU and all of the other academic institutions across Pittsburgh. We're based in Pittsburgh. Pittsburgh is ground zero for accountable care. Lots of things that are happening around value-based healthcare. We are ground zero for value-based healthcare across the nation. We really are, with all of the dynamics that we're seeing in the area. What's also interesting is, in our approach to all of this, we've been really cognizant to go back to our roots in Pittsburgh. I moved to Pittsburgh about 9 years ago from sunny Los Angeles to sunnier Pittsburgh. And I'd never been to Pittsburgh up to that point 9 years ago. And I was fascinated by the over 400 bridges that we have across Pittsburgh. And I said, heck, this is awesome, because I'm a bridge builder. Innovation should really be about building bridges. Less silos, more bridges. How do we make sure that we're able to take what is so natural to us here in Pittsburgh and really push the imperative for innovation in healthcare and other areas that we're all focused in, and go from all of this hype, everything that we're seeing across the industry, to hope, right? Those patients that look at us and trust in us to provide the best care that we absolutely can, to here. How do we make it real? How do we make sure that we increase our chances of success? That when we take that shot, we increase the chances of that puck actually going to the place that it needs to go to. So that's what we're about. I'm so happy that I had a chance to speak to you. It really is about fewer clicks and more moments. I want to click less and have more moments with those patients and with those people that are in front of us. And we're Pittsburgh proud. My goodness. All of the resurgence that we're seeing in Pittsburgh has been tremendous, and we're so proud with all of you in the room to be part of this resurgence, this new economy that is about innovation and entrepreneurship in the Pittsburgh area. And I'm so excited about the path forward. Thank you.